Welcome to another episode of Clinical Case Discussion. In the previous video, we have seen the basic introduction to parotid swelling and the preliminary anatomy related to the parotid swelling. Today, in this video, we're going to see only the history part related to parotid swelling. Okay, right. So, the basic history part of the case sheet will be having certain specific headings in an order. First one is patient details, chief complaints, history of present illness, past history, family history, personal history, treatment and allergy history, and obviously before the treatment history, if the patient is female and if it is relevant to our case, menstrual and marital history. For parotid swelling, usually there is no much importance of menstrual and marital history, so we can skip that here. Just for completion we can ask. Okay, so first one is patient details. So the basic headings we will be asking regarding patient details is, one is name, then age, gender, occupation, address. So what is the importance of each thing in patient details? So the first one is age. Usually in case of younger age group of people, there can be a swelling in parotid. There is a congenital condition called sylectasis. If you break down the words, ectasis means it is nothing but dilatation. Dilatation of what? Xylo means is nothing but salivary gland. So here, because of the dilatation of the parotid duct, because of the dilatation of parotid duct, there can be swelling of parotid gland, which is called sylectasis. Okay, and usually in middle age group of people, we will come across silolithiasis, nothing but salivary calculi, or even autoimmune disorders. Middle age group is also common for benign conditions like pleomorphic adenoma, etc. Okay, and elderly is more obviously it is malignancies are more common. Apart from the malignancies, we can also come across parotitis also in elderly people who are also immunocompromised, etc. So one possibility is malignancy. There can be even parotitis is also another possibility which can be seen in elderly. Then coming to gender, usually parotid related disorders or any salivary gland disorders are usually more commonly seen in females than males. Okay, right. Next. So coming to the chief complaints, there is nothing much significance of occupation and address. One important thing we can correlate is whatever the occupation that is related to radiation exposure. Radiation exposure. In such scenario, rarely it can cause lymphoma. Lymphoma is very rare in parotid gland, but it is possible. So whatever the occupation that is, let's say for example, a person working in a factory where there is radiation exposure, in the long run there may be development of lymphoma or even malignancy also. Okay, right, other malignancies, right? Next. So coming to the chief complaints, please remember 99% of the surgical patients will be coming to surgical OPD or the hospital with mainly either or with mixed complaints of three things mainly. One is swelling, pain, ulcer. These are the three complaints where 99% of the patients will be having this presentation. Okay. So here also in the parotid swelling, how does the patient come to us means, one is swelling. So swelling where? In the front and below of whatever right side ear or left side ear or even both sides. Then the another possible complaint we can come across is pain in the swelling. Then very rarely there can be. So if you take this is the ear we are having. Let's imagine this is the right one. In the front of the ear where you are having this parotid gland, more or less this is something like a parotid gland, and your duct will be like this. Wherever you are having fistula, there the main complaint of the patient will be there will be watery discharge from this area. So if it is something like a from the parotid gland area, it is gland fistula. Whereas if it is something related to your duct, that is duct fistula. So parotid fistula is of two types, gland fistula and duct fistula. Okay, very rare. And in the post-operative scenario, patient can come to us with this complaint of watery discharge in the parotid bed area. This is another complaint we can encounter. Okay, right. So even though we are writing on the paper like swelling in the front and below of right ear and pain in the swelling, etc., etc., when we are presenting the case in the examination or in general, we need to describe it in the form of a paragraph. We will see that in the next slide. That is nothing but history of present illness. So don't worry about this large slide. We will break down into pieces and we will see each component separately. As I told you in the previous video, where in the history of present illness, we are having three subcomponents. For any case, these are the three fixed side headings we can remember so as to understand the components of history of present illness easily. So I told you the first one is presenting complaint and the system involved. Second one is complications history. Third one is etiology history. So we will see one by one. First one is history related to the presenting complaint and the system involved. So I told you mainly the patient can come to you with swelling. So we'll see first about swelling. So, what are all the fixed things? No matter wherever the swelling is in the body, whenever the patient comes to you with swelling, what are all the things that we should ask in history of present illness? History of present illness is nothing but expansion of whatever the presenting complaint the patient has come to you with. So, how do you expand that? What are all the important questions that we should ask the patient? One, where is the swelling? There is nothing but site of onset. So, here in parotid, obviously the patient will be telling in the front or below or even back of whatever ear, that is on which side it is involved. Then duration is important because we need to understand whether it is an acute swelling or a chronic swelling. So usually if it is something like a months or years, usually it will be chronic. Instead of that, sometimes patient can present to you with weeks duration or even days duration. In such condition, it is nothing but an acute swelling. Okay, right. Next, why is site of onset important? Basically, if you consider this is the parotid gland, pleomorphic adenoma or any other condition, usually it can arise anywhere in the gland itself. But one important condition we need to understand is Warthin's tumor, which is also called adenolymphoma or cystadenoma lymphomatosum. It is more common in case of tail. Okay, so where is Warthin's tumor more commonly? Like it can present as in the swelling in the tail of the or in the inferior aspect of the gland. Right. Next, mode of onset is nothing but whether it is sudden onset or insidious onset. Again, it depends on whether it is an acute or chronic swelling. Then progression and regression. We will see what are all the important implications that we need to understand. So progression and regression. Then associated complaint. Whether the only swelling is present or if there is any associated pain or fever. Many a time, pain and fever will indicate, along with fever will indicate parotitis. If there is sometimes the presentation of pain is a different entity. We will see in the next slide. So, one important question we need to ask the patient whenever the patient presents to you with a parotid swelling, which is of weeks or months duration, usually the picture can be one possibility can be salivary calculi. That is nothing but sialolithiasis. How do you rule out sialolithiasis? Only in history, we need to ask one important question. That is nothing but whether there is any aggravation of the swelling along with pain whenever you think of the food or even whenever you take food meals, and there will be regression or there is a relaxation period, there is a pause in between meals. So this is the classical presentation the patient will be telling you in case of sialolithiasis. Okay, and one important question here the examiner can ask you is which major salivary gland has got highest risk of salivary calculi formation? It is nothing but submandibular gland. In the previous video, I have told you why submandibular gland has got a highest risk of salivary calculi formation. So, more viscous secretions, anti-gravity drainage, the submandibular duct is hooked by lingual nerve at one place. Okay, right. So, what are all the possibilities we can have based on the presentation? One, sudden enlargement of both glands along with pain. See, this kind of a picture can be seen in case of people where there is improper hygiene in the oral cavity or in case of dehydration, etc. etc. So, the possible diagnosis can be it will be acute parotitis. Another scenario where you can come across acute parotitis is ICU, where if the patients are not taken care of the oral hygiene properly, then also you can come across bilateral sudden enlargement of both sides glands and along with pain. Then if at all if you come across any a normal patient with unilateral parotitis, one important thing we need to rule out is sialolithiasis, because whenever the stone is sitting in the sialolithiasis is unilateral, most important. Whenever a stone is sitting in the parotid duct, it will obstruct the drainage of the parotid gland, and all the secretions will be pulled up in the parotid gland. There can be superimposed infection or inflammation that will cause the enlargement of the gland along with pain. Okay, right. Next, enlargement of all major salivary glands. This is an important syndrome. This goes by the name Mikulicz syndrome. Mikulicz syndrome. Then, along with enlargement of all major salivary glands, if you come across dry eyes along with the arthritis, that is called Sjogren's syndrome. Sjogren's syndrome. Please understand Sjogren's is of two types: primary Sjogren's, secondary Sjogren's. And more or less, secondary Sjogren's is associated with some other connective tissue disorder like rheumatoid arthritis or SLE, etc. etc. Okay, right. Next, slow growing tumor which is of months or years duration, most probably it can be pleomorphic adenoma. Okay, pleomorphic adenoma. Right. Next, it can be Warthin's also. Then recent rapid increase in size plus previously it was painless but now it became painful. This is nothing but a previously benign condition has transformed into malignancy. So most probably it could be carcinoma X pleomorphic adenoma, or it can be any other benign malignancy which has turned into malignancy now, which was benign previously, now turned into malignancy. Please understand, Warthin's tumor, most of the time, it doesn't have any malignant potential. Okay, but a long-standing pleomorphic adenoma can become malignancy. That is called carcinoma X pleomorphic adenoma. Right? This is regarding swelling. Now, the second important complaint can be pain in the swelling. You know the classical picture. Wherever the pain is in the body, you need to understand we will be describing with the help of a mnemonic Socrates. So one is duration, obviously, to understand what is the type of swelling we are dealing with. Then Socrates. So Socrates is nothing but one is site. Where is the pain? Then onset of pain. Then character of the pain. R for radiation or referred pain. Then A for associated features. Wherever the patient is having pain in the body, these are the fixed side headings we need to understand and remember to ask the patient regarding the pain in history of present illness. Right? Next. T for timeline or time course, nothing but progression or regression. Then E for exacerbating or relieving factors, nothing but aggravating relieving factors. Then last S is for severity. So this is the Socrates mnemonic we need to understand to ask about the pain, right? Now, what is the importance of each thing in parotid swelling? So please understand, whenever you are having character of the pain, one is obviously site onset, it is same for any other swelling. One important thing we need to understand regarding character is whenever you having whenever you have a throbbing type of pain. So throbbing pain. Whenever patient presents with very severe throbbing pain, more or less it will be associated with parotid abscess. Right? Next. Instead of that, previously painless swelling, later patient developed pain, it is something like a continuous pain or something like a dull aching pain. Maybe it can be a malignancy. Then another important point we need to understand is whenever there is a calculus sitting in the duct. So let's say for example, you are having, this is the duct we are having, and there is a stone sitting in the parotid duct. So whenever patient is having meals or whenever the secretions are coming like this part of the duct will try to contract very severely, constrict severely, which will cause a colicky type of pain. Colicky pain. So patient will tell, typically the patient is having intermittent crescendo decrescendo type of pain. Where will you see this colico type of pain means? It is sialolithiasis. Sialolithiasis. So these are the three important types of pain we need to understand in parotid swelling. Next, where will you come across the radiation of the pain? Again, whenever there is a pain in the parotid swelling, in an advanced case of malignancy, this pain can be referred or this can be traveled through the glossopharyngeal nerve or vagus nerve into the ipsilateral ear. So where can you come across radiation means ipsilateral ear. We will see that in complications. Then another important point you need to understand is aggravating and relieving factors we have already seen in relation to the swelling. It is nothing but this thing, sialolithiasis. This particular scenario is called mealtime syndrome. This is called mealtime syndrome. This is called mealtime syndrome. Next. So, regarding the pain, one important question we need to ask the patient is whether the pain has started along with the swelling, which is of acute duration usually. That is indicative of parotitis. The other scenario we can have is previously it was painless, then a dull aching long standing pain which later appeared, it will suggest of malignancy. I told you here. Okay, right. Next. This is regarding pain in the swelling. So this is a picture of a parotitis. You can see here enlargement of diffuse enlargement of gland and some part of erythematous changes here, and it will be very painful. This is nothing but parotitis, right? Next. So we have finished the first part of history of present illness. That is nothing but history related to the presenting complaint and the system involved. Now coming to the second one, history related to the complications. To understand that, I told you what are the possible complications we can have. Please understand, whenever you are talking about parotid gland, it is not just about the parotid gland, but also the other things which are in relation to the parotid gland. So one important now in relation to parotid gland is your facial nerve. Okay, so before that, I told you a previously benign condition can transform into malignancy, or it can start from the onset. It can be a malignancy swelling from the onset. So how do you know it could be a malignancy or not? One important question we need to ask regarding this transformation of benign into malignancy is recent rapid increase in size. And along with that, in general, whatever the malignancy constitutional features like loss of weight and loss of appetite, that is nothing but it is called cancer cachexia. Cancer cachexia. So, malignancy will be releasing certain cytokines which will suppress the appetite. That is why, because of the loss of appetite, patient will be losing weight also. Right? This is the classical constitutional features of malignancy. Right? This is one important thing we need to understand. Second one is history of facial nerve involvement. Only in history, how do you know whether the facial nerve has involved or not? So to understand that, we need to know a little bit about what are the important terminal branches of facial nerve. Along with that, what are the important functions of each muscle supplied by the branches of facial nerve. So you know that I have told you in the previous video, we have got a crow's foot here. That is nothing but the terminal branches of facial nerve, which is like this. So the thumb is nothing but your temporal branch, index finger zygomatic branch, then middle finger buccal branch, then ring finger marginal mandibular branch, last little finger is your cervical branch. So what are all the muscles supplied by temporal branch? See here you are having frontalis muscle. One is frontalis muscle. So along with the frontalis muscle, orbicularis oculi, which is surrounding the eye. So this is the orbicularis oculi. Okay. Then frontalis has got two parts. One is occipital leaf and frontal leaf. So here you are having frontal leaf mainly. Then other one is corrugator superciliary. Here you are having corrugator superciliary. So what is the normal function of orbicularis oculi? Orbicularis oculi for you and me to close the eyes. This orbicularis oculi is very important. So closing of eyes. Then corrugator superciliary is important in frowning. This is frowning. Okay. So frowning. Next, orbicularis oculi. Again, this is the another important branch which is supplying orbicularis oculi. Then you need to understand we are having buccinator. Orbicularis oculi is important. Then in zygomaticus, this is the table we need to understand. So for closing the eyes, orbicularis oculi. To raise the eyebrows, this will be more important in examination. We will see in the examination part. frontal belly of occipitofrontalis. Next, for frowning, corrugator superciliary. Next, we need to ask the patient whether there has been any facial asymmetry. So, why do you want to ask that? Because normally this nasolabial fold is maintained by this levator labii superioris aliquae nasi is the primary muscle which is maintaining the nasolabial fold. If there is facial nerve paralysis, what happens? This muscle will be gone. That is why there will be loss of this nasolabial fold. Then another important point you need to ask is, so these are all the important history regarding the facial nerve involvement. You can remember top to bottom. So one is difficulty in closing eyes, then whether there is any facial asymmetry, then whether there is any deviation of angle of mouth, then whether there is any drooling of saliva, and the last one is history of difficulty in blowing of the mouth or whistling. Okay, so these are the important questions in history we want to ask to know whether facial nerve has been involved or not. Then I told you history of pain or discharge in the same side here, because this is because of the radiation of pain in advanced malignancy. Okay, right. Next, whether there is any history of difficulty in swallowing of food. Usually, whenever there is deep lobe involvement of the parotid gland, it will displace the tonsils. So tonsils will be displaced medially. So patient may have little bit difficulty in swallowing the food. Okay, right. Next. So whenever there is a suspicion for malignancy, I told you one of the important complications we have is malignant transformation. Whenever there is suspicion for malignancy, means patient is having a decent rapid increase in size of the swelling, or whenever there is history suggestive of facial nerve involvement, or there is loss of appetite and loss of weight, then you need to ask the history which is related to metastasis. So mainly metastasis from the parotid tumor will be to lungs, bone, or lymph nodes. So regarding that, systemic involvement we need to ask whenever it goes to brain and all. In general, whenever you are talking about systemic metastasis, you can remember again top to bottom. So first one is CNS. Just remember what are all the main symptoms of that particular system. So one is headache. Second one is loss of consciousness. Then any seizure activity. Right? This is the main chief complaints, I mean, symptoms related to CNS. Then CVS, you can ask about shortness of breath, especially this exertional dyspnea. Okay, right. Next, respiratory system, cough or chest pain, or even hemoptysis, nothing but blood in the cough. Again, SOB. Then GAT mainly related to liver. So the main feature will be jaundice. This is a history suggest of metastasis in whatever malignancy related to the systemic metastasis. Right? Next. History related to the etiology. Now we have come to the third part of the history of present illness, that is nothing but etiology history. So I told you main important etiologies which can cause parotid region swelling is, one is any benign conditions like pleomorphic adenoma, warthin, etc. In acute conditions, one important infection which is related to acute parotid swelling is nothing but mumps. So whenever you have got mumps, especially in male patients, three important P's we need to understand, or three important clinical features we need to understand is, one is parotid, second one is pancreas, last one is testis, or even epididymis also. Okay, so these three organs are mainly involved in mumps. So mumps usually cause bilateral parotiditis. So along with the parotid swelling, there is any associated abdominal pain to rule out pancreatitis. Whether there is an associated scrotal pain to rule out epididymoarchitis, especially orchitis is more important in mumps. Next, India is the world capital of tuberculosis, so we need to rule out TB by asking history related to tuberculosis. Then we need to ask history of dryness of the mouth, eyes, or joint pains. Why joint pains? I told you it is related to something to your Sjogren syndrome. So this is one of the important connective tissue disorders which can cause parotid region swelling. To rule out that, we are asking about dryness of mouth and eyes along with joint pains. Right? These are the possible etiologies which can cause parotid region swelling. So we have finished the history of present illness. Now coming to the past history. So one is history of similar complaints in the past to rule out recurrence. Then medical history. I told you whenever you want to do parotid surgery, usually it will be done in general anesthesia. So it is more important for anesthesia purpose to give general anesthesia. Also, TB can also cause parotid region swelling. Then diabetes mellitus and hypertension. Diabetes mellitus is an immunocompromised condition which can be predisposing to a parotid abscess or even parotitis also. Then hypertension is important. I told you in the previous video we have already discussed, right? Epilepsy and stroke are important for again for general conditions. Then surgical history, whether there has been any surgery in the same region. Again, true or recurrence. When will be the recurrence usually? One, there has been a benign swelling which was incompletely removed. Then it can cause, this particular parotid swelling. Usually, any pleomorphic adenoma has got pseudopodia. If you leave any of the pseudopodia, it can give rise to recurrent swelling. Then another one is whenever there is a malignancy, again, if there is incomplete surgery or faulty surgery, it can cause recurrence, right? Next, family history. One important question we need to ask the patient is any history of head and neck cancers. Okay. Another important condition which can run in family is connective tissue disorders. So these are the two important points we need to understand in family history, right? Next, personal history. So you know the classical headings: diet, appetite, sleep pattern, bowel and bladder habits, addictions. So one important point you need to understand here is, in general there are two types of diet: acid diet and alkaline diet. In parotid swelling, alkaline diet is more important, which can cause salivary alkali, etc. Then appetite, I told you it is lost in diabetes mellitus. I mean, it is lost in tuberculosis and malignancy. So whenever there is loss of appetite, it may suggest you that it can be a malignancy. Then sleep pattern, in case of acute parotid swellings, in case of inflammatory swellings, it is more important. So nothing but in case of parotitis, there will be severe pain which will disturb the sleep of the patient. Bowel and bladder habits, nothing much to do here. Then another important point you need to understand is smoking causes one important condition of parotid gland, nothing but Warthin's. Okay, so Warthin's tumor is more common in smokers, and please understand Warthin's tumor is more or less in bilateral more commonly. Then in general, alcohol causes bilateral parotid enlargement. That is one of the most important signs of liver cell failure. Okay, so betel nut chewing. Why is betel nut chewing important? I told you in the previous video. It is something like it can cause oral cavity cancer. This oral cavity cancer can cause lymph node metastasis in preauricular region. So this can cause preauricular lymph node metastasis. That is the significance, right? Next. So menstrual history, and it's not that important. Marital history, not that. Just for completion's sake, we need to ask. Treatment and allergy history, you need to ask. One important question regarding whether there has been any needle poked previously, because sometimes quacks can do some irregular things or abnormal things. So whether the patient has gone to any local doctor and some intervention has been done or not, we need to ask. Right. Next. So general examination, I told you in previous part in the introduction video we have already seen general examination, the conscious, coherent, cooperative, etc. Out of all those things in parotid swelling, two important points we need to understand is whether there is any dry eyes to rule out keratoconjunctivitis sicca, which is a part of Sjogren's, or even Mikulic's also, generally Sjogren's. Then along with that, whether there is any butterfly rash or malar rash. You know that butterfly malar rash is classical presentation in case of SLE. I told you Sjogren's is of two types. So one is primary Sjogren's, which is not associated with any connective tissue disorders. Another one is secondary Sjogren's, which is related to connective tissue disorders. There will be associated connective tissue disorders. And one of the most important connective tissue disorders is nothing but your SLE. The others are rheumatoid arthritis. So SLE is the most common connective tissue disorder related to your secondary Sjogren's. Okay. So this is importance of history part in parotid swelling. We will see the local examination and management part in the next video. Thank you.